Gena Bofshever, my chiropractor extraordinaire.
What's up?
Why'd you get into chiropractic?
Well, great question. Always wanted something in the health field, but wasn't sure what. Grew up thinking medicine was the end all be all of everything. No real true idea about natural health. Had friends and family that were chiropractors. They did really well, seemed to like it. I said, let me consider that. Applied to school, got in, and that was kind of it. I'm not really the person that's like, what do I ultimately want to be and do? I just knew I wanted something in the health field. So I kind of entered it, not really knowing what it was about, other than that it felt good.
Has it been what you thought it would be?
It's been better than what I thought it would be.
Yeah, how so?
So I thought, like most people think, that chiropractic is about treating pain, and it does for a small percentage of what we do. But I came to find and learn along the way the philosophy piece of chiropractic, which is that the work that we do through the adjustment restores how the brain and the body communicate through the nervous system, which ultimately changes people's lives for the better. So it's been this big eye-opening thing where I help people say yes to chiropractic so they say no to drugs and surgery.
So like what type of things get better because you get adjustments and because you do chiropractic? What would I experience as a client?
Sure. Well, it looks different for everybody, right? Because actually the first adjustment that ever happened was back in 1895 to a guy that lost his hearing. And D.D. Palmer said, convince this guy to lay on a table. His name was Harvey Lillard. This is true chiropractic history. He pushes on the guy's back and his hearing is restored.
Whoa.
So 1895, he starts advertising, come to me, I have the cure for deafness in Davenport, Iowa. And all these people start coming to Iowa and their hearing's not getting better. But this person's digestion's better and this person's heart issue's better. And so he started to say, hey, there's something to this. And that's how chiropractic was born. And then his son, B.J. Palmer, developed it and really worked on the philosophy, and it took off from there.
And there's a Palmer school.
Sure. Yeah, that's the Fountainhead. There's up in Iowa, and then there's another one down here in Florida. But you had asked me, like what kind of things would people experience? So really it could be anything. So I would say top things when it comes to kids are going to be things like frequent ear infections where they stop having those, or we've helped a lot of kids avoid having ear tube surgeries or failed ear tube surgeries. Digestive issues like constipation, not only for babies, but adults too. Headaches, focus and clarity, better sleep, latching issues. I mean, there's so many things that chiropractic can help with.
What is it? I know nothing. I get headaches because, if this hurts and I could see it maybe going up there. But how about all those other things? Latching, a baby not latching?
Yeah. So you have to look at everything's being controlled and regulated by the nervous system. So it's the brain and the spinal cord and the signals it's sending from the nerves. And so if there's interference, which happens from stress, chemical stress, physical stress, emotional stress, we're all exposed to it. So the more stress that we have, our body can only handle X amount of stress load, right? So if there's overproduction of stress or overexposure to stress, our system starts to shut down. So we have these things called subluxations. It's interference in how the brain sends the signal down the spinal cord out to the nerves to the end organ, tissue, cell, or part of the body. So what happens when you get adjusted, it's kind of like going to the breaker box or the fuse switch and you flip that.
Reset.
So we're restoring that flow from the brain down the spinal cord. So a lot of people think that we're specifically working with the spine. We use the spine to access the nervous system. That's really what we're working with. And because the nervous system is what's controlling every other organ system in the body, respiration, circulatory, all of it, musculoskeletal, it affects how all of that functions.
Wow. And is it because things get kinked up? What's the problem?
Sure. Well, there's different mechanisms by which it could happen. You can even have inflammatory problems happening because of lifestyle choices, right? So
diet.
Yeah. Chemical stress, things we eat, things we drink, drugs, both prescription and not. Like even medications can have a direct effect on how our body functions and responds and adapts. So when there's any kind of interference to the system, it's now not going to, it can affect it functioning at 100%. So if you're not at 100%, then we can see that show up down the road as a physical symptom. So a lot of times people think that, again, for chiropractic, it has to be this pain complaint for a physical symptom. And again, that's a small piece of it because pain's usually the last thing to show up and it's oftentimes the first thing to go away. But if someone's continuous enough, under care long enough, with repetition enough through chiropractic, they'll start to see miracles. And I know that sounds ridiculous to say, but we see everything from we work with a lot of neurodivergent kids, so ASD, autism spectrum, things like that. We have nonverbal kids start under care and start speaking. We're not treating their autism, right? We have kids that have multiple absent seizures throughout the day to having none. Real things that'll behavioral issues that'll allow kids to now stay in school where they couldn't before. So it's actual miracles that'll change life for people without medication. So there's a time and a place for that. But if you restore that flow from the brain down, the body's going to do what it's designed to do, and the body's designed to heal itself.
Yeah. And aside from adjusting the spine and or manipulate, or I guess getting to the nervous system through the spine, what do you recommend for these folks who, whether they're kids or adults, on their diet? Because if you said they could be causing this through the things that are inflammatory foods, right?
Sure. So my cheat is that if it lived, walked, or grew, it's going to be good for you, right? If an item sat on the shelf for most of its life, even if it's organic and non-GMO, that's not going to be your best bet. So I live by that as much as I can. Lived, walked, or grew, good for you.
Yeah, that's the way to go. What do people, I'm always wondering this because I had a lot of lower back pain. I'm much better now. What do people go in for? What's the most common
Most common things are going to be sciatica, low back pain, neck pain, and headaches. I would say those are like the top things where people are like, oh, when I go to a party and they find out I'm a chiropractor, they're like, oh, I haven't needed you. And I'm like, well, that's weird because you probably have a brain and a spinal cord. They don't know. And I'm just like, that's cool. I'll see you one day. Yeah. But those are the most common or typical things. Carpal tunnel. Think of your most common pain complaints. That's typically what walks through the door. And then we go through a huge patient education process where we aim to teach people and give them tools so that they can increase energy and lower stress and start feeling and functioning at their best. And that chiropractic becomes part of their lifestyle routine. So oftentimes people look at chiropractic kind of similar to medicine, where it's a Band-Aid or a pill or a potion to treat something. We're not treating any specific thing. That headache is a direct effect of interference happening, right? That neck pain or that back pain is a direct effect of interference in the neurology. What we're doing is removing that stress that's been now caused on that nervous system so the body can heal, can look different for different people, because we don't know what's their chemical, physical, and emotional stress load on the regular basis outside of the office. So we have workshops where we kind of scratch the surface of, hey, here's some lifestyle changes you can make. And then we refer out to professionals who specialize in like proper eating, right? They can work with nutritionists or specialists who know, like that's their realm, right? They need specific soft tissue work. We're going to send them to the specialist for that. What we specialize in is chiropractic. How does the brain and the body speak to each other? Yeah.
What are other recovery type? Because I don't know. To me, it just seems like it's the kind of therapeutic chiropractic. It's almost like a meditation. I don't know. It's like a reset.
Yeah.
Getting in a cold plunge, doing a sauna, chiropractic. I see it all like that. What are some other things that you do or you recommend or you think that really help people, whether it's in the physical, the mental?
There's so many things that I do or recommend.
I know you're into that.
Yeah. So what we teach a lot in our practice is the 5 pillars of health. So you've got proper nutrition, adequate motion, quality rest, positive mental attitude, and properly functioning nervous system. So the properly functioning nervous system piece is the piece that most people are missing in their daily lives because they don't even know how to assess it or see how it's working and functioning. It's interesting now because a lot of times on social media, you'll see people, this calms my nervous system, or your nervous system will feel good around people that make you happy or that are good for you. And a lot of people never used to speak about the nervous system, and it's kind of like catchphrase now. But nervous system, that's what we focus on. But all of those other pillars, the foods we eat, things we drink, drugs, prescription and not, how we move our bodies, the thoughts that we think, the quality of our rest, they're huge. So when you talk about things that we could do in general to better our lives, well, it's going to be, like we talked about with food, less processed, more whole foods, so that we have adequate fuel in our body to keep us going. Moving our body. And a lot of times people think this means you have to be high intensity training. I know you do jujitsu, all these other things. And like those are great, and strength training is extremely important. But sometimes it's just a matter of moving our bodies and getting outside.
Go for a walk.
Walking, right? We live in South Florida. It's like the perfect time of year. Yeah. I did an hour-long walk this morning, and you also get sunshine, so vitamin D, and you're out in nature. So if you want to reset your nervous system or change your mood, just go for a walk, right?
It's a great way to start the day.
It's awesome. So that would be, motion. And then you can, like, I have a trainer. I've trained with my trainer every Tuesday and Friday for the last 12 years. The only time I take off is when I have maternity leave, which I did 3 times, or if I'm traveling or if I'm speaking at something. Otherwise, I'm there. So that's my commitment.
And what are you doing in those
strength training?
Strength.
But functional strength training. So it's functional movements. And then it's actually, my trainer speaks with my physical therapist who designs workouts that strengthen my weak areas. So it kind of all together helps me get stronger. when I was younger, it was not that I'm old, but like when I was younger, it was more about like looking a certain way. And now it's more about feeling and functioning a certain way.
Yeah.
And the looks come with it, but it's challenging my body in functional movements that are going to allow me to keep moving all the way through the future.
And functional are practical movements that you'll do for the rest of your life.
For sure. So like squatting, but like I have kids, right? So I'm picking them up, lifting them all day long. So I have to be bending and moving in proper ways and squatting in proper ways so that I don't create or allow myself to get an injury. Same thing with the work I do. A lot of it's very physical. And if your ergonomics or your setup when you're adjusting patients is off, you will get injured.
Yeah. When something gets injured, let's say you're adjusting someone, or the average person is doing a movement all the time, and let's say, I don't know, their left hip is a little off. It is all so connected, right? Because then I've had that happen. And then by the end of the month, my left heel or my right heel is hurting, right?
Sure.
All this stuff's connected.
Yeah, the body's going to compensate too, right? So you can get away with a lot more things when you're younger because your body hasn't had years of compensation, right?
Yeah.
But macro trauma, which are like your big, large-scale impacts like car accidents, falls, and injuries like that, are things that most people think of, hey, maybe I should have a checkup by a chiropractor or see someone, even if I'm not necessarily feeling pain or symptoms. But micro traumas are repetitive, small stresses that can have just as big of an impact, sometimes even more than a macro trauma, because we're doing them repetitively, sometimes for years. So like a guy sitting on a 2-inch thick wallet on the right-hand side every day, starting at age 14, showing up in my office at 65, bent over because he threw his back out when he sneezed or picked up a pencil, and you literally see like a square on his jean pocket worn out from just wearing his wallet all the way there, right? Something so minor and small. Day to day is not a big deal. Week to week, not a big deal. Month to month, maybe it's a problem. But year to year, certainly now we have a repetitive stress pattern that the whole body's going to have to compensate for.
Man, how many of us haven't done that? I don't know if it's okay, but I keep my wallet in my back pocket. But when I was young, I'd sit on it. And then someone told me, fortunately, I was probably still in my teens. So now I move it so far to the side that it's just on my hip on the side, right?
Yeah, no,
that's
then
okay?
You're good. That's okay. As long as you're not, because if you sit on it, you're creating this wedge. And so one side's more taut and one side's more lax, and you're going to create a compensation there. Women do it with purses. I do it with my own kids even. I have a side that I favor of holding them on, and I try to always be conscious of flipping that. People do it at work all day long. By the way, everyone's guilty of it. Everyone's got a cell phone. If you watch how people are on their cell phone, everyone's bent forward, right? We have gravity working against us all the time.
So the head's down. What's that going to cause to the neck after years of doing that?
Well, you'll see changes happening actually on x-ray, because it's normal to have a C-shaped banana curve in the neck. And so you'll start to see curve losses in there. Like even as a kid, you'd look up at the ceiling and play outside with your friends, and like most people are looking down at everything now, right? And as we age, again, gravity will bring us forward. So if we're not doing things to bring us out of that, like pull movement exercises, extension exercises, being mindful of our posture, because we're spending so much time forward, we're actually training our body that's normal. Wow. Yeah. And when kids now are little kids, they could pick up a phone and know what to do on it. And it's not like we hand them the phone. They just know. It's wild.
Yeah, that's all they know. They're born into it.
Yeah,
that's right, because you've gotten me to straighten my neck out a lot, using that white
Deneral,
that foam thing.
Yeah, so that's like an instrument or tool that we use if we see a curve loss on x-ray for someone, the number one thing we want to do is remove the subluxations, that interference in that neurology, but we also want to work on restoring that curve. And so the Deneral is an at-home device that you can use to help with that based on if your films show that you're a candidate for it. But there's also specific exercises and things that you can do to strengthen that area back up.
Yeah, so rather than being rolled this way, it's those pulling back, rowing type exercises.
So you want to stretch the tight muscles, so think of your flexors, and you want to strengthen the back muscles, which are the extensors. That's all your pull muscles. So like pull-ups, pull-ups, chin-ups, seated rows, lat pull-down, those kinds of things.
Yeah. I saw a photograph of myself a year or two ago at an event, and my head was leaning very much forward, and then I went to see you, and my neck got better. Because, I noticed I was always leaning forward. And, it's from a phone, from everything. And I do jujitsu and a lot of push-ups. And those are both forward. I need to do more of the back and the rowing.
Well, it's not anyone's fault, because, like, if you look in a mirror, right, what are you going to want to work? The parts you can see.
Yeah, I can't see back there.
You can't see it. So there's this, like, propensity for people to want to kind of, we're creatures of habit. We could see it. You get more motivation when it looks good. So you're working like buys, pecs, all the things in the front quads, right?
Quads, no hamstrings.
Right. No, you don't need those, right? But you do.
Yeah. And those imbalances, they say that could lead to injuries, right?
Absolutely. And then it's also those smaller intrinsic muscle groups that really matter a lot. And those oftentimes get overlooked by people. So like, for example, the muscles in the rotator cuff, they're not sexy to work because no one's seeing them, but they're super sexy in terms of functionality, strength, stability, right? Like we need those to be strong. Otherwise, we will get injured.
And those are like light weights doing like a 90-degree type motion.
You got it. So you could even do some of those without any weight, but if you're doing them, you would start with super lightweight, like 3 or 5 pounds and repetitive motion, getting you out of that.
Yeah, I always, before I work out, that's my first part. I get like a 5 pound and I just start rotating my rotator cuffs before I start lifting because I think I might tear something. That's a fear.
Yeah, well, you got to do what you got to do then to get that fear out. But you do that by taking action, which would be strengthening those smaller muscle groups, which are going to support the larger ones. Yeah. And again, because we can see the large ones, those are the ones that we focus on, but those smaller ones will make a huge difference. And I know that you and I were talking about before, for just like hacks of how do you mentioned cold plunge, things like that. So there's like a whole host of things that I recommend for people, but we touched on like very basic, touched on nutrition, motion, quality sleep is a big one for people. Like people will go through the motion of sleeping, but they're not actually getting into rapid eye movement or deep healing sleep. And that's where your body is going to heal itself, right? So if you're going to push really hard, but not ever repair, then we can also have a problem. And then we've got positive mental attitude. So under that umbrella are things like prayer, yoga, meditation, breath work, just literally breathing. There's so many different things that we could do to get ourselves more centered, more calm, and you can track that with like HRV and things like that tell you how well your body's actually functioning. But the chiropractic piece that we talked about, like with neurological function, like how well your nervous system's functioning. So in the beginning, when people will see us, it's usually because of a symptom base, right? Or they heard me talk somewhere, so they want to come in for an assessment. But the average person walking through the door has XYZ pain. They're like, oh, I heard chiropractic could help. They're thinking I'll come in 1 or 2 visits, kind of like when you take a medication and it just goes away. But that's just putting the Band-Aid on it. If you want to actually fix the underlying problem and get results, then there's options for that. But the real beauty in chiropractic is when you're under care beyond that. Because when it becomes part of your lifestyle routine, like just like I work out with my trainer twice a week, no matter what, like I don't miss an adjustment weekly, no matter what, whether I have symptoms or not, whether I'm in pain or not, whether I feel good or not. Because I understand that the more clearly connected my brain is to the rest of my body, the better my food's going to digest from the food choices I make. The deeper my sleep's going to be, the better able I'm going to be able to properly move my body. Like it's interconnected with all of that.
Yeah. What do you think about, and I know you don't get into this, I'm just curious, you know anything about peptides?
Very, very, very little. I know that they're supposedly awesome. Great for you. I don't do it in the office, but I have people I could refer you to for that.
Well, I just started.
Okay.
I'm 2 months in taking something called hexarelin.
Okay.
It's for recovery of muscles. And aside from a little neck pain right now from a little jiu-jitsu incident recently, I've never felt better.
That's amazing.
I feel like my muscles are younger. I don't know if it affects joints. I don't know how much of it's a placebo.
Yeah.
But I'm recovering.
That's amazing. I mean, that's really the ultimate goal, is that the quicker you could recover, the healthier you are. And so when you look at things like HRV or heart rate variability, that's telling you how adaptable your body is.
Under stress, right? You get your heart rate up and how quickly you can get it back.
Yeah, so if your heart rate stays the same when you're in a stress response versus relaxation, then there's not a lot of variability, and that's a less well-functioning individual. Okay, and the more that variability happens, the healthier you are. So the lower the score you'll see on the HRV. So if someone scares you right now, right, it's going to affect your heart rate. But then how soon you can recover or come back down to normal rest.
That's a sign of health.
Mm-hmm.
Okay.
That's your adaptability of your heart rate variation. That's heart rate variability.
How quick you get it back. So let's talk about, I think I know the way you think about these things, but pharmaceuticals. I'm sure there's a place for them. Would you agree?
Absolutely. Like if I was, God forbid, in a car accident and my arm was hanging off, please don't bring me for an adjustment or give me peptides, or maybe I need peptides. I don't know enough about them, but take me to the hospital, give me the good stuff, sew my arm back on, And then I'm happy to explore all the other options.
Where do you think, because I'm sure you see this in your practice, where do you see that it's abused? Not by the patient necessarily, but by maybe doctors or pharma just pushing it? Where is it happening?
I mean, you see it all the time where here's where I'm not okay with it, when it becomes as a lifestyle choice, right? So like there's no one pill that's a cure-all. It just doesn't exist. There's no pill that can outdo the effects and the results of lifestyle choices, right? Like exercise, food, all the 5 pillars we talked about. There's no pill for that. I wish there was. That would be amazing, but there's not. And sometimes every once in a while, it seems like all of a sudden there's a new magic pill, and then people jump on that bandwagon, and then we come to find out there's like class action suits because of all the horrible long-term side effects.
So you mean like Ozempic in a year or two?
Yeah, like how everybody all of a sudden was like super thin, and I get it. Like it's tough to put in the work to like work on your body and all those changes, but you know, we don't know what the long-term effects are going to be on all of these things. And that medication, like, while it's great that it can offer that as an option for people to make a lifestyle change, that is not a lifestyle change, right? Yeah. It doesn't replace moving my body and eating healthy foods. Yeah. So the abuse is really like, and then I'll have patients sometimes that come in and they're on 3 medications for the same thing. And so I'll ask them, like, my job's not to take people off medication. I'm not a medical doctor. I don't prescribe medication. I don't tell people not to take a medication, but I encourage people to ask questions to the people who are prescribing them. And so my question's always, okay, well, what's the long-term game plan with this, right? So you're starting this medication now, right? You're 35 years old, sitting in front of me. What does 45, 55, and 65 look like? Are you still on this medication? When's the retest? Like, how do we know? Is this just a forever? And you know what the answer typically is? I don't know. Right? So we're like, okay, let me take this, but there's not necessarily other guidance that comes along with it. This is why I really like functional medicine. So functional medicine is not just, okay, you have a problem here, let's treat this one thing. Functional medicine is looking and considering the body as a whole being and really looking for inflammatory markers and things like that, and encouraging people to make lifestyle changes based on them individually, right? So it's not just a blanket like, all my patients take XYZ supplement, right? It's like, okay, well, you need this supplement, but that person needs a different form of that supplement.
Yeah. And that starts with blood work for that individual and food allergy tests and those sort of things.
Like there's blood work, stool tests, saliva tests, urine. Like when I first went to see my functional medicine provider, they took 16 vials of blood. I was like, guys, like that seems like a lot, right? Yeah. And I had to answer a questionnaire back since birth. I had to call my mom to find out questions because they understand that the chemical, the physical, and the emotional stress load, not from today, but we're the result of preconception even. Like health and status of sperm when it meets the egg actually has effects on your health long term. So when people say, well, it's just my genes, epigenetics is your expression of those genes, and you can turn that on or off based on your lifestyle choices, right? Yeah. So yes, we're all victim to some capacity of our genes, but we can make choices that are going to express that more, or we can change that pathway.
My wife was just telling me before we started recording, I was talking to her on the phone, and she said she's having, I don't know many things about medical stuff, but Zoomers, she's doing these tests to see all these things, and she's eliminating food, and she's feeling amazing, and she's doing all that. But her levels show, the person who's doing all the testing is saying, you must have an autoimmune disease somewhere. There's something because of the certain markers, but you're in great shape and it hasn't presented itself because you haven't triggered it. You know, it's there. If she were anyone else potentially in her own family, it would show up because, she wouldn't take care of herself, but she does take care of herself. And she has people in her family who we've done competitions on the steps with and I see they're doing like 3,000 steps a day. That's it. While we're hitting 20 something thousand a day. And yes, then they get the diseases and then those things show up.
Yeah. But you know what? A lot of times, Joel, what makes something show up is stress. And so when you get a really high stress load, your choices are then going to be the determining factor of how does your body respond to that, right? We're all exposed to these same things, but again, what lifestyle choices are you making, like your wife? And thank God she does that because she's lessening her chances. But if she all of a sudden walked into some high stress load thing, that could cause that to have physical symptoms start to show up.
So how do you avoid stress?
Well, you can't fully avoid it. Stress is a part of life, right? There's eustress and distress. So distress is like, I gotta, like, someone cuts you off on the highway, right? There's certain stresses, like, we can't avoid that one. But stress is good stress. Sometimes stress motivates us to hit a deadline or make something happen, right? There's just, stress exists in life, but the way that we process and move through that stress is going to be the determining factor. So like a high stress thing happens, I could use tools like, depending on the stress, things like breath to kind of bring me from sympathetic more into parasympathetic state, right? So you can make choices to eliminate or reduce your chemical stress from the products that you use when you're washing your body and cleaning your food, your dishes at home. Like, I don't use any like plug-ins or any of those synthetic fragrances, or they're hormone disruptors. They affect the body. And now it's even, I've cut those out from my life as much as possible. So like if I walk, the other day I just came back from Mexico, and every car I got into had like some fake smell, and I was like sick in every car ride. Wow. And I'm like, why? And as I was younger, this didn't used to affect me. And it's really interesting when you start to detoxify these things from your life, the second you're exposed to it, now you're like hypersensitive to it, which you would think it would be the opposite, right? Like if you don't have it at all, and so now you get exposed to some, you think like, oh, my threshold is fine. And meanwhile, someone else who's like totally toxic, making terrible choices, they walk in that car, they feel great. Yeah. And so it's just wild to me how the body works like that. But if you think about, like, I don't really drink alcohol. So like if I have one glass, I'm like super buzzed. So the tolerance changes for someone who's drinking all the time. One glass does nothing for them. So I guess it's the threshold changes.
Yeah, your new normal is different. So anything out of that is you're gonna feel it. Yeah. So what are ways breathing? Man, when you're in that moment though, you're so stressed out. How do you remember? It'd be awesome if like a phone would vibrate or a ring or something to tell you need a meditation break or you need a...
It would be awesome if that happened. I know a lot of people, they'll wear like the different rings or pieces of jewelry that'll track kind of heart rate variability, so they can go back and actually see after the fact, like, hey, that was a high stress moment. My HRV went really low. Right. Or like I was feeling good. My HRV score went really high. So you can actually, there's data that you can match up to those things.
Yeah, start learning about yourself in those situations. In that same situation, maybe I get cut off and I overreact. Maybe you get cut off and you're just naturally not the type of person gets worked up over that.
Well, I'm from New York, so I always get worked up over that. And then I have to drive over to them and I have to look at them.
Yes.
And sometimes I have to give them the finger, but I learned my lesson in Atlanta not to do that after someone followed me. So I just quietly give it under the dash.
That feels good?
Yeah, it feels good. That's like, my relief.
Yeah. I think it was Abraham Lincoln who would do this. If somebody wronged him, he would write them a nasty letter and then just take the paper and put it in his drawer.
Fire? Oh, okay.
Yeah, maybe throw it away eventually. That's a good one too. But yeah, you just get it out of your system.
Yeah, it's like, as you mature, you learn, maybe I know that this person wronged me or did something, and it's like, I have to tell them, but it's like, sometimes you just have to let it go, and it's easier said than done. Yeah. For sure.
But I agree. When I was younger in my 20s, if someone cut me off dirty style, I would speed up, get around them, and I can't believe I'd cut them off. And I think, wow, I could have really turned into something ugly. Now I would never. I just let them go. Yeah. I'm not going to worry about that. But
that's actually maturity. So great job.
Yeah. And I also don't want to get shot.
Yeah, there you go. So that Atlanta thing kind of scared me, and I was like, no.
Yeah. If I was a girl, I'd be more scared about somebody following me home. That's scary.
Yeah. Yeah.
Yeah. Okay. So when I've been to your office many times, the first time I was shocked to see a baby getting an adjustment.
Yeah.
Tell us about that, because I know that baby didn't complain about any symptoms. Yeah. That means the patient, the customer there is the mom. Or dad, who said, oh yeah, I agree. What's happening with that baby?
So we do open adjusting in our office so that it's a learning opportunity. It's an educational moment for everybody. So when you come to my office, you're surrounded by bellies and babies because we are a full family practice. And so we do a lot of patient education with our families as they're even in the preconception phases or people dealing with fertility issues, so that they understand if that connection in the neurology is flowing better, then the body's going to grow and develop better. And we know that healthier babies and kids tend to become healthier adults, right? Mm-hmm. So the body is developing tenfold neurologically when we're babies to what it's happening for you and me right now. This is why it's even more so important for them to have a checkup. So in the office, we do full assessment on every single patient. But when we work with babies and kids, we do nerve system scans where we'll look at temperature differences on the spine. We'll look at surface electromyography, so muscle tone, things like that. And we'll assess HRV. And then we have scans that'll give us patterns and show us what's their stress pattern. Are they in it or are they out of it? And we combine the objective findings between the scans and what we're actually seeing when we do our physical assessment on the baby, coupled with physical symptoms that parents may share, the subjective findings, to determine, okay, what's actually needed. Now, that's if a baby or a kid's symptomatic. And side note, when we work with babies and kids, you're not hearing the pop sounds like you're hearing in an adult. Right. It's pressures, and it's no more pressure than you'd use when you check how ripe a piece of fruit is. And so parents all the time are like, that's it? And the answer is yes, that's enough to correct a neurospinal issue. Think about how much more force happens even in a completely natural vaginal childbirth, right? What comes out first? The head. The alignment's off, there's pulling and pushing. Now we understand it can have a direct effect on how the brain's sending the signals out. We want that as clear as possible, as much ease as possible in that system, especially while that baby's growing and developing.
So you're just lightly pressing to straighten things back up?
So there's light presses. We also have some instruments that we use as well. But yeah, it's gentle pressures and through there. And so we do a lot of patient education. So because you asked me, how do they find us? So for our general wellness ones, those are typically either they've come into a workshop or a talk that we've done, or they've just been a part of the practice so they understand that, or we've kind of explained that to them through their pregnancy, that what they want to do after they deliver is come in as soon as possible for their postpartum checkup and postnatal checkup for baby. Then we'll have on the complete other end where we have like symptomatic kids. So really severe torticollis where they're kind of stuck, and now it's going to cause things like plagiocephaly where it starts flattening on one side of the head during this development period. Maybe they're favoring, and so indicators would be like favoring one breast over the other when they're eating, or taking the bottle only from one side, or the kid's actually like stuck in their stroller. You can peek at them and kind of see signs for things like that. So we did talk earlier about latching issues because of the alignments off in that upper cervical area or in the cranium. Now that can affect the cranial nerves, which affect eyes, ears, nose, throat, face, mouth, like jaw. We have constipation, reflux, colic, issues sleeping. Like the list goes on.
And you see results after a certain amount of time? Yeah,
but every patient's different, right? So like sometimes miracle visit for someone's visit 3, and sometimes it's visit 33. And I can't tell you what that visit's going to be. That's why, because we don't know how your body's going to respond. But this is why we put a plan together based on that, what that individual needs, so that we're not doing guesswork, and we go back in and we reassess along the way with all of our patients, whether someone's coming in because they were injured in a car accident, or we have a baby that's there for a wellness check, or you have someone that woke up with terrible sciatica. Like, no matter who the patient is or what reason brought them in, we are always reassessing and rechecking at their progress exam so that we know, do we need to change things up in the office? Do we need to guide them and help them change things up outside the office? Do we need to refer them to people that specialize in that to help them?
If you ever see, I don't know if you see them as patients, but sometimes I'll see a little old man or a little old lady walking down the street and they look like they're 100 and they're like a question mark.
Yeah.
What is that? And can that be avoided, or what could that
Well,
be?
a part of that, depending on what's causing it, but a part of that can for sure be avoided. That's gravity taking over in a lot of the cases. Now, you can have severely degenerative, like osteoporotic and osteopenic and rheumatoid and osteoarthritic patients. But a lot of that can be avoided based on like the things we talked about earlier with like lifestyle. So I'm seeing a lot more. I start taking films. We do digital X-ray in the office, so we'll start doing that when our kids are anywhere between 5 and 7 and they can stand up without moving, because we want to also assess if there's a scoliosis in there, right? So we want to have a baseline, like how is this kid showing up, especially if there's concerns about something. And so when we talked about earlier, you should have that banana-shaped curve in the neck, but we see a lot of curve loss happening in there. So it could happen from falls, accidents, injuries, but it also can happen from those looking down all the time, right? So we're seeing that in a lot kids younger. And so what happens is that's phase 1 of spinal degeneration. So over time, if that's not corrected, then that progresses to phase 2, where now it starts to affect the disc in between the bones. The shape of the bone can actually start to change. And then over time, and by time we're talking years, it's not an overnight process, that can move into phase 3 of spinal degeneration, which is going to be multiple segments, right? And so that's where we like lose our height as we age because our discs get affected. So they get smaller. The bones change shape. They grind down, so they get smaller. And then our overall posture and ergonomics repetitively over time is moving us in that direction. So gravity works against us unless we're doing things.
Is it realistic? Because I swear when I used to measure myself to today, because I have teenage boys, they measure themselves. So I jump in and get measured too with them at home. I am convinced I've lost a half inch in my almost 50 years.
Yeah, because when you have degenerative change, it's disc desiccation, where the disc itself loses some of that hydration in there, right? And there's no direct blood supply to the disc, so you can't just like restore it. So you really, really, really have to be hypervigilant about taking care of it because you only get one body. There's a lot of things you could replace in your life, but you only get one body. So that's where things like peptides and all that fun stuff come into play.
Yeah. Okay. So yeah, I've lost that half inch, unfortunately. But then I look at my dad, who used to be taller than me all my life, and now I'm taller than him. So despite me losing a half inch, I've passed him.
Still winning. No.
I'm still winning. Yeah. If my dad played basketball, I'd challenge him. So there are different modalities over the many years. I've gone to different chiropractors, and some will do things like traction and pull the neck out. Some don't, and some crack things a certain way and they move them. Are there just different schools, or do different chiropractors adopt a different way of doing things?
Yes to both. There are different schools with different focuses on the science, the art, and the philosophy. So the science is just the reasoning behind all of it as far as like your research is concerned and the biology of the body, things like that, the biomechanics. The philosophy is the whole idea behind chiropractic and how it works and how it functions with the nervous system. And then the art, which is the technique. That's the adjustments. And supposedly there's over like 200 different techniques. And here's the thing, Joel, they all work. All the techniques work. It's just a matter of finding the one that works best for you. So like we have different techniques that we use in the office. I say there's like 5 or 6 different ones that we use in the office. And so depending on the patient and how they're presenting and what's going on, we'll pull from any one of those at any time. And there's cases where I've referred out to my fellow chiropractors like locally because I think they need a different technique or a different approach. And vice versa. Like they'll come to see us because we practice a different way than they do. And it's not that one's right or one's wrong. It's that this works well for you, right? And so like anything else, you have to seek out like what the right fit for you is.
Yeah. This is a weird question, just a mechanical question. Why in chiropractic is there that table that drops?
The drop?
And it just crank it up, drop, crank it up, drop. And I've had that done so many times in my life. What the heck is that? I've never stopped because the chiropractor is busy and I don't want to stop you and be like, what are you doing?
So it's an adjustment technique. So a lot of times people think like that expectation of that pop sound, right? And they're like, oh, you feel that release, you heard it. So there's like satisfaction in that, right?
Yeah, I love that.
But that's why we always joke, don't be addicted to the crack, right?
Yeah.
Because you may not hear that pop sound, but it doesn't mean that you're not getting a great adjustment.
You told me that once during an adjustment.
Yeah, because if you do drop work, then you're not necessarily going to hear that pop or that crack sound. And by the way, nothing's cracking, breaking, or popping. That sound is just gas or air coming out from the joint, okay? But so that's Thompson technique uses a lot of that where the table drops. Again, another technique for adjusting people.
Yeah. For me, that was always like near the hip area, lower back, like S.
Yeah. So the table,
joint.
We use that a lot on the SI joint, but the tables that we have drops on multiple areas. So like a doc that practices CBP might use different technique, uses those drops in different areas because they do a lot of like posture correction and mirror image exercises. There's like whole different kinds of techniques when you dive into it. There's energy techniques where they don't even touch you and there's huge changes happen. Like the research actually backs it up and shows that people like the osseous like pop sound adjustment. Other people don't like that. So there's...
Well, you know how popular that popping is. Have you seen the
what
channel?
Is it, ASRM or...
Well, there's that. Yeah, like the scratching.
MR.
Yeah, those scratching and noises. But there's a channel on YouTube called Crack Addicts where they're cracking people's spine and the videos have like 5 million views.
Yeah, people are into it. And then we have people that come in and they're like, don't do the thing. And so it's just, to each his own. Everybody's got their own thing going on. And I will say this, like if we have a severely osteoporotic patient coming in, we're certainly not going to adjust him or her the same way we would adjust you. You know, you have to take patient consideration into it.
Yeah. I know that you want evenness when in the body, balance and all of that. But when you train sports, there's going to be a disbalance or an imbalance because, I don't bodybuild. I'm not lifting weights to look pretty. But when I do something, let's say a move in jiu-jitsu, I'm right hand dominant. So I want to get my arm under your arm with this one so I could throw you that way. Mm-hmm. It's very difficult for me to do it the other way. My brain doesn't work that way. The strength's not the same. And I'm not going to do 10 and 10.
Sure.
So I'm going to be uneven. Is that going to cause problems?
Well, there's also things in our life, like if you think about it, when you drive, everybody uses their right foot no matter what.
Yeah, you have to.
Right? So like there's certain things in life that we can't, they're like kind of outside of our scope. We can't account for them. We can't control them. And that's why I always say make good choices, because where you can make the choice and you do have the capacity to choose how you're going to do that, I could be in balance when I'm sleeping, right? Versus I can't do it when I'm doing jiu-jitsu. But that choice matters. That choice becomes so much more important because there are instances where you can't choose. So my choices outside of that realm are even more important.
Yeah, control what you can. Speaking of that, I don't know that I can control the way I sleep because I've been told to sleep face up. That's a good one. But I do that. Now my mouth opens and I snore. Then I put a piece of tape on my mouth and that'll help a little bit. But then I panic. I get into this thing where I feel like someone's choking me and I have to rip it off. And sometimes I can't rip it off. And it's a horrible night from then on because then I'm wide awake the rest of the night. I felt like someone was trying to kill me. And also I feel like something's going to hit me in the face when I'm sleeping for whatever reasons or traumas in the past. Can't sleep face down. I feel very uncomfortable that way. And also it puts pressure on the bladder. So I'm a side sleeper and I go back and forth, left, right. Once this shoulder goes numb, I go to the other one.
Yeah.
I can't control that. What would you recommend?
So with sleep, it's funny because really what you want to do is you want to try to maintain a neutral posture. So if you're on your side, which you can be, take the pillow to prop your head up, right? Put a pillow between the legs, keep the pelvis balanced. And a lot of people move in their sleep. I do too. I was a stomach sleeper, and that's not my go-to for people or what I typically recommend because you have to be rotated one side or the other for hours at a time. So it's not good for creating imbalances in our body.
Unless you had a hole in your bed. Maybe
right, you just have to sleep on a chiropractic table face down all night. But like I had to break that habit. I put a pillow barrier next to me. I had a bunch of pillows. So instead of doing like a complete turn, I was about like 45-degree angle and I had to kind of retrain my body. And at the same time I was having body work done to work on my restrictions in there. Because a lot of these are stress patterns that start from when we're really little.
Things up.
Yeah.
Yeah. I got a full body pillow now and I lay on my side with a good pillow here on my neck or my head. And then the body pillow I think it keeps my spine aligned.
Yeah. So there's little hacks and tricks for everything, but we can't control 100% of the things. So you do, let's say 80-20 rule. You do 80%.
Yeah. You
make the right choice.
Yep.
20%'s gonna.
Yeah. I found this, I don't buy too many things on social media, but they got me with this Facebook ad. It's this wedge pillow.
Okay.
And it has a hole in it where your
so it
arms,
doesn't go numb.
Yeah, and it was amazing for the arm. I could sleep on my side fantastically well. The problem is the wedge was so elevated it hurt my lower back.
Right, there's always something.
Yeah, they probably sell another one. Oh,
right,
and for that, use that. Yeah,
just
exactly.
An extra $30.
Yeah, well, these are like a 200. It was expensive. So talk to me about cool cases. Something where I don't know, a miracle or something.
Yeah, I mean. For me, it's definitely a big win and a miracle when someone's nonverbal and starts speaking and is able to tell their mom, I love you. Wow. And like a mom comes in crying because their baby said that to them for the first time. And I don't mean a baby where, it's a natural progression of that age. No, these are like kids that are supposed to be having in their age range, like full sentences and able to fully communicate. And they're not able to just for many different reasons. I have a couple of cool cases. One, a progress exam we just did yesterday on one of our neurodivergent kids. Parents brought her in because highly disruptive, like she's ASD on the spectrum, can't focus, a lot of like verbal noises all the time, very hyper, can't focus. You can't touch her even. So like when we do the scans in the office, sometimes the big win for these kids when they start getting adjusted is that by the time we reach a progress exam, they're able to sit still enough and allow us to actually run the test or scan that we need to do in the first place. So this one little girl in particular, yesterday, I just read her note. She just had her progress exam. And not only is she doing better in school, the teachers are like, because they're going to have to now take these kids and they're telling them they're in danger of having to be kicked out of school, right? Because they can't focus. So it's so disruptive to everyone else. So it's really stressful also on the parents, like having to deal with that. What do we do, right? So able to focus. They were just at an event. She got her face painted, which she's never done in her life. Like let someone sit there and paint on her face, right? And like all these huge things. And you think, wow, that seems so small. But for this kid and the rest of her life, it's so, so big. Yeah. And she's 9 years old, 8 or 9 years old. And it's the sweetest kid. And like we see tons of cases like that all the time.
That's amazing. So a couple interesting things. I think it was when I first met you, it was at a holiday party at the bar, and I met your husband, and I was blown away by the fact that, at least back then, I don't know today, you're the worker. Yeah. You own your own business. And he stays at home with the kids? Is that still the case?
Sort of. So we didn't intentionally set out for that. I never in my life thought that this was going to be how it was. So yeah, my husband, Bobby, he's the best. He has been a stay-at-home dad for a while now. And so when we met each other, he was working for a startup, and we were expecting that it was going to go a certain way. And it got to the point where it just wasn't making sense to stay there. I love the work that I do. My business, thankfully, is successful. We help a lot of people. And so that's never something that I plan on walking away from. And it's kind of like where I shine. It's like when I'm in the flow and in the zone, like I enjoy it. It's fun for me there. And so when we started having kids, and his mom at the time was ill, he needed to go out of the country to visit her. And it just got to the point where it didn't make sense for us with what it would cost us financially and also time-wise for our kids to be in something, for us to both be working. And it just made more sense for him to stay home. And I say like the default parent, right? So like if a kid's sick, the default parent's the one that like has to drop everything, and they're the one in charge of that. And so because that became his role, like he fully stepped into it. He does their breakfasts, lunches, their dinners, bedtime, bath time, all of that. And I think that that's the much harder job, no joke, the much harder job than going out to the office and going and doing anything else. Like that to me is the hardest job. And he was always like, he doesn't want other people raising our kids. So like it's very important for him to be involved. And he's way more calm and chill and relaxed than I am also, which is
patience.
Definitely helpful. Like I have very little patience, whereas he has a lot more than me. Yep. So that kind of worked for us. And so he now is, he's actually developing an app, and they're in the final stages of development. And next stage is he's got his MVP. He's going to go for funding. So pretty cool.
He might get a little busy then.
Yeah. And so the goal is that he can exit, right? Still do the things he wants to do, like take care of the kids and all that. And I'll still have my thing just because I like it.
Yeah. And a lot of chiropractors that I've met, I don't know if it's your case, it's not a 40-hour-a-week job often. Is it for you?
Well, yeah, you got to keep in mind that we service the 9 to 5 people, right? So like for us, we have weird hours. And we take a 2-hour break in the middle of the day, and people are always like, what do you do there? So we're doing like patient notes. We have team meetings. Like we do doctor's trainings. Like there's a lot of things that happen. Like 2 hours isn't enough. I have a 1-year-old. I'm pumping in that break, right? So like a lot of stuff happens because when we see the patient, we also have to like record and document everything else that happens. So there's a lot of patient management that happens behind the scenes other than what the patient's just seeing face to face when they're there in the office for X amount of time. But yeah, we're open till 6, 2 days a week, till 7, one of the weekdays too, because, we're in Fort Lauderdale area. So the people that work in Miami and get out at 5, by the time they drive back to Broward in traffic, they're not getting there by 6 o'clock. So we need to be able to be open to see them. And then on Saturdays, actually our highest demand day because you have families that want to come in. Like most people during the week can get a little hectic. So like on a Saturday, we might see anywhere from 50 to 70 plus patients in the 2-3 hours we're open.
And there are several of you, several chiropractors working.
We've got 3 docs.
Yeah. I told you this once. It was when I first met you, and just like a typical patient, I popped a rib out of place, which still shows there. It doesn't hurt at all anymore. So I thought, well, that's when I'll go see you. Yeah. Turned out I ended up improving some other things, and that wasn't really something that could even be fixed because it was a floating rib way down here. But so I got there early because you said, all right, come right in. I was in really bad pain. That was probably one of the worst pains. I've been injured a few times, but that one was bad. Yeah. And I got there early. Somebody let me in, and you guys said, sorry, we're having our little huddle meeting right now between the employees, but you guys let me in so I could just sit down and relax. And I watched the meeting. Yeah, I've been a business owner all my life. I coach, and I was so blown away by the way you run the office. People have earpieces. It's like the Secret Service in there. Everyone knows everyone's name. First of all, I want to know how they know when you first walk in, how do they know the name?
You weren't like a stranger on the street. You had an appointment. So it wasn't tough for us to know, hey, that's probably Joel coming in for his 9 o'clock appointment since he's rolling in at 8:45.
Yeah, sure. But I just saw person after person coming in, and the staff was amazing. They knew people's name. I guess, they're looking. There's no picture on file?
No. Okay. Listen, everybody has to give a photo ID so we can identify who you are, but we're not looking at that. What happens is like we train on that, right? We train on like Ritz-Carlton 5-star service. This is very important to us. And so like you think about what are your expectations when you go to a 5-star hotel, right? Like you're going to welcome me by name. You're going to take my bags right this way and escort me. And so we aim to do the same thing. Like I want you to think of whatever your traditional doctor's office experience is, and then we aim to do the exact opposite
it's
of that.
Completely opposite.
Like I've gone to offices where the staff's behind like a little piece of glass and they're like, don't knock on the glass. And then they open it up, like, give me your stuff. And then they close it and then you don't know what's going on. And then you're waiting like 2 hours. Yes. Someone's never spoken to you. And you're like, what the heck is this?
Well,
right?
You walk into yours, it's all open. Everybody's greeting. Everybody's like, okay, you'll be right here. And then when it's your turn, they send you here and it just flows. And I'm an efficiency stickler, and it just all flows. There's no frustrating time when I'm there. So I just got to tell you that it's the best medical office I've ever seen run.
Cool. Thank you. So, that's a huge compliment because we aim for that. We strive for that, but we train for that too. So like, it's not just like all of a sudden it happens this way. From everything from, if you were there before hours, I don't know if you heard like our morning huddle.
That's what it was.
You did, yeah. So we even our intentions are purposeful. Like in the morning when we come in, all of our team says out loud, today's a great day. And so it's a barometer that we use to check in with each other on like, if you walk in and you're like, today's a great day. You're like, you all right? What's going on? You know? And then we stand in a huddle. We say our morning affirmations. We go over what's our mission, what's our vision, right? Our vision is that we are the epicenter of natural health in South Florida, right? We want people coming to us before they go to drugs and surgery where they can. So that's a big mission. And because of that, we know that we want to serve a lot of people, and you can't do that if you don't have systems and flow in place. Like you just can't. It would fall apart. It would be stressful on team. It would be stressful on patients, and it would just seem like chaos. And don't get me wrong, there's definitely chaotic moments. Sure. I'm not going to sit here and lie about that by any means. But
do you operate your life as well as I saw many times? So it wasn't one time, the way you run your business?
Yes and no. I would say it's a lot harder for me now because I have a 4.5-year-old, a 2.5-year-old, and my youngest is going to be 1 on Monday. So this weekend he's turning 1. I am a very regimented person. And so before having kids, it was like, okay, wake up at this time. I say my morning affirmations. I do my dry brushing and go in my cold shower. I got my whole routine with my oils, and I'm starting my day with my lemon water and And now my day sometimes starts when this one wakes me up in my bed because of a pee accident, like today, even though I was in a dead sleep, or I haven't slept in the last year because my 1-year-old likes my boob all night. Like, so now I just kind of take it where I can. So now at least I get to shower, but there's usually someone watching me in there as I'm like spraying the water on them through the glass, right? Yeah. Or like I'll just really quickly dry brush before I get in if I remember. But like I have certain non-negotiables. So like Tuesday, Friday is my workout day and time. So like those are my days where I'll drop the kids off. So I'm as regimented as I can be. It's just I'm in this weird season also postpartum where I'm breastfeeding, I'm not sleeping, I'm running a business, I have my other kids. Like it's a lot. And so I had to kind of give myself some grace where I try my best to eat the cleanest and do these things, but it doesn't always happen. And so I think that also comes with aging as well, where you say, okay, give myself some grace here and then allow myself X amount of time and then just pick right back up and make a better choice again.
Could you ever see yourself working for somebody else, or is this entrepreneur lifestyle? No, but going forward.
No,
that's it. Well, now that
maybe side by side with someone, and it's funny because I never thought of myself as an entrepreneur, as a business owner. I kind of like fell into it, and then it suits me, but there's definitely stresses that come along with that, right? I couldn't see myself working for someone else, but I wouldn't be opposed to working side by side with someone.
Mm-hmm. But you don't have partners now, right?
No, not currently.
Yeah. Well, you're doing a great job.
Thank you.
Where's the business? Is it Plantation, Florida?
Yeah, we're in Plantation, Florida. So we're 20 minutes west of downtown Fort Lauderdale.
You're on Broward Boulevard, right?
Yep, we're on Broward Boulevard. We're just east of University, and I like that location because it's really easy to get to from Broward, from downtown, or we're right by all the highway connections. And like, Joel, we have people that drive to see us from down in the Keys. So they're driving 2+ hours to come to our office. So we try to set it up for them where they can come in a morning shift, come back in an afternoon shift, right? And then I'll laugh because someone in the one town over, they'll be like, it's too far. I need someone closer. And I'm like, we literally have people like, this person flew in to see us. Wow. I'm like, you're a 20-minute drive. But I'm like, that's cool. Let me send you to someone right next door. I get it. It has to work logistically, because if this does become part of, which is what we want. If we want you to adopt this as part of your overall health lifestyle. So like, I don't miss a week without an adjustment. So it has to logistically work. And if it doesn't, then we're going to help you find someone close to you so it does.
And on the internet, it happened often whenever I had to call you. I didn't even remember if I had you as a contact. I would just put Gena Bofshever on Google and it'd pop you right up. But what's the best way to find you if someone locally wants to see you?
Oh, cool. Check out favoritechiropractor.com.
Really? You have that website?
I have it. And so I always, when I was first like branding and going around, I was like, hey, it's your favorite chiropractor, Dr. Gena. So like people like refer to me as that, but we actually own the domain favoritechiropractor.com.
Wow.
I was like shocked when I saw that it was available. I was like,
great.
Yes.
Yeah.
So that's ours. But if you want to find us on social media, our handle is Dr. DOCTOR Gena, Gena. So people call the office and they'll be like, hey, I'm really good friends with Dr. Gena. And they're like, I'm sure you are. I'm sure you are. Well, Dr. Gena is with patients right now. She'll be sure to call you back, sir. Like,
Dr. Gena, that's funny. All right, Dr. Gena, thank you for being here. I think this has been a fantastic time learning from you and getting to share.
Thanks for having me. Bye, guys.